This podcast is hosted by Will Glomsky. Will is an experienced critical care paramedic working on a ground ambulance. This podcast is purely educational, and the opinions reflected are of the hosts only. This show is not intended to supersede any local protocol or training. This podcast covers educational content surrounding emergency medical services. Welcome to the Midnight Medic Podcast.
Hello and welcome to the Midnight Medic Podcast, the podcast where we bring knowledge, experience, and tools directly to you, the EMS providers making a difference every day. I'm Will, and today we're diving into something that's likely been on your radar recently, respiratory syncytial virus, or RSV. Let's be real, RSV is no longer just a pediatric issue. Cases are rising all across age groups, and as EMS providers, we're often the first point of contact for these patients. So today we'll cover what RSV is, who's most at risk, what signs to look for, and how can we best care for these patients in the field. So what is RSV? RSV is a common respiratory virus. For most people, it causes mild, cold-like symptoms. But for infants, young children, and the elderly, and those with compromised immune systems, it can lead to serious complications like bronchiolitis and pneumonia. So who is most vulnerable? It's primarily infants and young children, particularly those under 12 months old or born prematurely, as their immune systems and airways are underdeveloped. Now it's starting to affect the elderly individuals more, especially those over 65 with chronic conditions like heart disease or COPD, as their immune systems are weaker. Immunocompromised patients. This group includes people undergoing treatments for cancer, organ transplant recipients, or individuals with HIV. People with chronic respiratory or heart conditions, such as asthma, cystic fibrosis, and congestive heart failure, or CHF. Or individuals in crowded environments. Daycares, nursing homes, and hospitals can facilitate the spread of RSV. As emergency medical providers, we need to assess these groups carefully during respiratory calls. What to look for? Let's talk about recognition. RSV often starts like a common cold, but can escalate. Keep an eye out for these red flags. In infants and young children, rapid or labored breathing, nasal flaring, retractions, wheezing, and cyanosis. Also watch for signs of dehydration like fewer wet diapers or lethargy. In adults and the elderly, shortness of breath, wheezing, and worsening symptoms of chronic conditions like COPD or heart failure are red flags. When you're called to a patient with suspected RSV, focus on the ABCs: airway, breathing, and circulation. Here are a few specific tips. Airway management. Infants are obligate nose breathers. If nasal congestion is severe, suctioning can provide significant relief. Carry pediatric-sized suction devices and ensure they are ready to use. Oxygen therapy. Monitor SpO2 levels and provide oxygen if indicated, generally under 94%. Start with basic methods like the nasal cannula or simple masks. For severe cases, escalate to high-flow nasal cannula or CPAP if available and within your scope of practice. Nebulized medications. While bronchodilators may help with wheezing, their effectiveness in RSV cases vary. Use them in alignment with your local protocols. In some situations, saline nebulation can help loosen mucus and improve airway patency. Heated high-flow nasal cannula. Heated high-flow is an advanced oxygen delivery method that provides heated, humidified oxygen at high flow rates. This approach can improve oxygenation, reduce the work of breathing, and aid in secretion clearance, especially in pediatric patients with mild to severe RSV-related distress. While not commonly used in pre-hospital settings except for critical care, its adoption is increasing in advanced EMS systems. If your agency supports heated high flow, ensure proper training and equipment readiness. Positioning. Keep infants and young children in a position that promotes ease of breathing, such as semi-fowlers or the sniffing position. For adults, encourage a position of comfort, often sitting upright. Hydration. Dehydration can exacerbate respiratory distress. Assess for signs of dehydration, especially in infants, such as sunken fontanelles or dry mucous membranes. If protocols allow, consider IV fluid therapy for severely dehydrated patients. Continuous monitoring. Utilize pulse oximetry and, if available, capnography to monitor respiratory status. Watch for trends that may indicate deterioration, such as increasing CO2 levels or dropping SpO2. Reassurance and calm environment. For both pediatric and adult patients, anxiety can worsen respiratory distress. Provide reassurance, minimize loud noises, and reduce unnecessary simulation. That means turning down the lights or not using lights and sirens to transport some of these patients. Infection control. RSV is highly contagious. Protect yourself and others by donning proper PPE, including gloves, mask, and eye protection. After patient care, decontaminate equipment and ambulance surfaces thoroughly. This is considered an airborne disease, not just a droplet. Advanced treatments. While most RSV cases are managed supportively, there are advanced treatments to consider in severe situations. Ribavirin is an antiviral medication that may be used in high-risk, severe cases, although it's rarely administered in the pre-hospital setting. Another possible treatment is monoclonal antibodies. For high-risk pediatric patients, medications like palivizumab can be used prophylactically to reduce the severity of RSV. Mechanical ventilation. In extreme cases of respiratory failure, patients may require intubation and mechanical ventilation, emphasizing the importance of rapid identification and transport to an appropriate facility. Finally, ECMO, or extracorporeal membrane oxygenation. For patients who fail conventional treatments, ECMO may be used as a last resort, though this is beyond pre-hospital care and requires specialized centers. It's crucial to recognize when advanced care may be necessary and prioritize rapid transport while providing supportive measures. For infants and the elderly, RSV can deteriorate quickly. Err on the side of caution with transport decisions, especially if the patient exhibits persistent hypoxia despite oxygen therapy, significant respiratory distress, signs of exhaustion from labored breathing. Preventing the spread of RSV. So finally, let's talk some prevention. RSV peaks in fall and winter, but cases can occur year-round. As EMS providers, we're at high risk of exposure. Here are some tips to prevent RSV, especially in high-risk populations. For EMS providers, strict hand hygiene. Wash hands thoroughly with soap and water for at least 20 seconds after each patient encounter. Use an alcohol-based sanitizer when soap and water are unavailable. Personal protective equipment. Always wear gloves, masks, and eye protection when caring for patients suspected of having RSV. Use gowns if there's a potential for splashes of bodily fluids. Environmental cleaning. Regularly disinfect surfaces and equipment in the ambulance using EPA-approved disinfectants. Pay special attention to high-touch areas like stretchers, monitors, and door handles. Avoid touching your face. Refrain from touching your eyes, nose, or mouth to reduce self-contamination. Limit spread among crew. Avoid sharing personal items like stethoscopes or pens. Stay home if you're feeling unwell to prevent transmitting the virus to others. For high-risk patients and families, vaccination and prophylaxis when available. Palivizumab, with a monoclonal antibody available for high-risk infants to prevent severe RSV, or other newly approved RSV vaccines for older adults and pregnant women can protect vulnerable groups. Reduce exposure. Avoid crowded places, especially during RSV season, fall and winter in most regions. Limit close contact with individuals showing cold or flu-like symptoms. Keep surfaces clean. Disinfect frequently touched surfaces, including toys, doorknobs, and phones. Practice respiratory etiquette. Cover coughs and sneezes with a tissue or elbow. Dispose of tissues immediately. Teach children not to share utensils, cups, or pacifiers. Encourage good health habits. Ensure adequate hydration and nutrition to support the immune system. Promote regular sleep and exercise for overall wellness. Preventing RSV in the EMS environment requires vigilance, education, and adherence to infection control practices. For patients, preventative measures often hinge on reducing exposure and maintaining hygiene standards. So there you have it, a quick dive into RSV and how it impacts our role as EMS providers. Remember, early recognition and proper intervention can make a big difference in outcomes. If you found today's episode helpful, please share it with your colleagues and subscribe for more content tailored towards EMS professionals. You can also reach out with your questions or suggestions for future topics at midnightmedicpodcast@gmail.com. Until next time, stay safe out there, take care of your patients, and take care of yourself. Thank you for listening to the Midnight Medic Podcast.